I will be explaining the amalgam procedure in order. You're going to need a water syringe, an HVE, and a saliva ejector. The doctor will also need a high speed with a low speed also on the tray with the doctor's choice of burrs. These are some of the burrs that he needs to have on the tray. We're going to start off with spreading the anesthetic gel on the tooth to make sure it is numb before we go ahead and have an anesthetic. We'll use these giant applicators. This is the syringe we're going to use to help numb the tooth. You're going to first pass the mirror and Explorer to help the dentist see any imperfections in the mouth before starting the procedure. You will need to have the die-called basin liner ready for the doctor for direct and indirect pulp capping. You will then use a Toffemire for class 2 restorations. Once the Toffemire is in, you will need a wedge to hold. This is the amalgam. You're going to put a capsule on there once you activate it yourself by either pushing down or on the table. This is the amalgam carrier used to carry the amalgam into the procedure. It will be used to remove the amalgam from the amalgam well, which is this. Holds the amalgam in the procedure. This is the first tool you're going to give the doctor. It's a condenser. It's going to make sure all the amalgam's condensed to the tooth. The doctor will then use an acorn burnisher to carve any anatomy onto the tooth. Cleo Disclose remove any material restoration around the tooth. You will use a spoon excavator to remove any debris from the tooth. The restorative cutting instruments are used to cut the enamel are the gingival margin trimmers, which is for distal and mesial. A hatchet will also be considered another carving instrument. We'll then use the cotton pliers to remove anything out of the mouth safely, as in the cotton rolls, any 2x2 or cotton pallets that are in the procedure. Once everything is removed out of the mouth, you will then use the articulatory paper holder and paper to see the bite. Once the doctor sees that the bite is even, he will then use floss to clean out the interproximal surfaces with floss.